keeping everybody very, very busy. Recently, just about a week ago, a message from the Caribbean Public Health Agency, COVID-19 alert moderate to very high following reports of imported cases in the Caribbean. But we're reading in the newspaper today, 35 tested in Trinidad and Tobago, all negative.
All negative, yes.
Right, so how worried should we be?
That's a very good way to start this conversation. I think that is the question on the minds of everyone, as it should be. Like we were speaking about during the break, we do have a responsibility in our communities to ensure that we protect ourselves. And in that, like with any other viral illness, by protecting ourselves and decreasing the likelihood of transmission, we're more likely to protect the most vulnerable in society. So people who cannot readily access care, the elderly, the very young, the immunocompromised. To answer your question specifically, this is something that should trigger worry in all of us because of the rapid spread. But to be fair, if we look at the reports that are coming out internationally, while it's spreading quickly, the mortality rate does not exceed some of the other viruses that we've seen in the past. So while we should be concerned about how our system will be able to deal with this, there's a lot of negative publicity that's coming out of it that really is very counterproductive, and that's part of the reason why the Medical Association has tried to engage communities via the media to make sure that the pandemonium doesn't override logic and common sense in dealing with these problems.
Well, we've just come out of Carnival. And we're preparing for Pagua celebrations, which is also mass gathering.
Right.
All right. In some countries, there's fear, there's anxiety, and this is sort of pushing the panic.
Right.
Right. It's fueling the panic. But have you seen or have you noticed that citizens here in Trinidad and Tobago being a little bit more proactive?
I think so. This is something that should be addressed continuously. And when I say that, what I mean is viruses are nothing new, as you know. The common cold goes around, and Avery, who was here last time, always makes this little light-hearted joke that Trinidadians don't take things seriously. So we will get really ill after Carnival, and it's probably influenza, but we will call it the big truck, we will call it the whatever, I don't even know some of the names, but we always have some funny name for it. When really and truly, for years gone by, what we should have been doing was protecting ourselves and preparing our systems to make sure that we could deal with this. And that is really a task that goes beyond the ministry and beyond anybody who is in an administrative role into communities and into what we teach our kids and into what we do. Because again, if you look at the way that this spreads, there's simple ways to prevent the likelihood of getting it. It's not, you can't prevent 100% of it, of course, just like with any other virus. But at the same time, with proper hand washing technique, with proper respiratory precautions, so like sneezing into your elbow, coughing into your elbow if you have to, those are ways that you limit the amount of spread. So it goes from your respiratory passage into your elbow as opposed to just floating around in free air. So I would say people are being more cautious because they are frightened and becoming more aware. So I could tell my funny story now, I suppose. So my wife and I were walking around in our store, which I will not name, and there was an Asian couple in front of us. They were not speaking English, so they were probably from mainland in Asia. And my wife actually sneezed. We were behind them in the line waiting to cash, and because she sneezed, the entire store stood back from these poor people who had nothing to do with her sneeze, obviously, and they looked at them in almost a menacing fashion, and that was unfair. That speaks to on multiple levels, but that speaks about the xenophobia associated with this, but it also shows a heightened level of awareness of wanting to prevent contracting this virus. But what I'm getting at is that we should be doing this for all viruses. So we see people walking around and they're just coughing in the air from times gone by. And that's really a culture that needs to change. People just go around spitting in the middle of the street. Those are not hygienic things, and they really should stop. And hopefully this will be the opportunity where we as a people come to a point where we realize that certain things spread disease and we will stop doing them.
Yeah, I met this pharmacist there the other day, and she told me that she realized that this is something about Trinidadians, that we just don't take things too seriously, and how we look after ourselves. But we're always jumping on something that it's somebody else's fault when we have to accept responsibility.
I agree.
Yeah.
And community engagement is a big part of it. Just to speak to that point of xenophobia as well, if you look at some of the reports that are coming out of assaults on Asian people, even in Europe, because they think that they're going to get this from any Asian that walks around, and that's really unfair. And we were speaking before we started as well about even in the local population and in migrant populations in Trinidad, that we actually have to look after their well-being as well. Because if we only say we're looking after people who are what we would say Trinidadian, but we don't look after them and educate them on these same topics, then we are missing an opportunity. And if God forbid this starts to spread in their population, it will get into the local population as well. And therefore we have a responsibility to ensure, whether you're from Venezuela, whether you're non-English speaking, it does not make a difference. The purpose of public health is public health.
Correct. Okay, so let's get to the virus itself. And this is something that fascinates me. How does this virus work?
Yeah. So, there's so many different viruses. I'm not a virologist by any means, but most viruses are inactive until they get into the human system. Once they get into the human system, they of course have I would say a preference as to which organ system they develop in. And that's why some viruses will cause gastroenteritis, as opposed to some viruses which will cause respiratory symptoms, which is what coronavirus is. Coronavirus is actually named after corona, which is a crown, so not any other coronas that people may be familiar with. But it is a respiratory virus, meaning that it is acquired via the respiratory system, so the nose, the mouth, so when you breathe in, and that's why when you look at the advice that's coming out, it's not to touch the eyes, not to touch the mouth, because if your hand has picked it up from any surface, and that's an important point, it can be on any surface, and in healthcare settings we try to wipe down our surfaces as much as possible to sterilize. Once it's in your system, it starts using your own cells to replicate, and that's why certain populations are more vulnerable. So people who are immunocompromised, for instance, are not able to mount that response to limit the spread within the human body, and will develop some of the end organ complications. So in this case, it not just will accelerate to cause an organ problem, meaning that it goes from the upper respiratory tract to the lower respiratory tract, but it will also start to spread, which is the nature of any virus. So when you sneeze, when you cough, the particles of the virus will leave with that sneeze and try to get onto other surfaces and spread.
So what makes it fatal?
So in the case of and this is not limited to coronavirus. This is actually how a lot of the viruses that cause respiratory illnesses work. In that they go from causing just a simple cough and cold, and in certain populations or those who are at risk, they develop what would be called a severe acute respiratory illness, or SARI. And that actually is what is fatal. So it's essentially a viral pneumonia, and it causes respiratory distress. It decreases the amount of oxygen that the body is able to take from the lung and send to other parts of the body that would require it, which is everywhere. And as a result of that, the human body cannot survive with low levels of oxygen to vital organs, and that's what will cause people to exhibit symptoms of respiratory distress, and end up in hospital requiring respiratory support, and that's where the problem with this is.
Tell me, what is SARI again?
Severe acute respiratory illness.
Severe acute respiratory illness. Okay, so how do you go about testing for coronavirus?
So we've had people who come in and ask for a corona test, a COVID-19 test, and that's not always appropriate. So Avery would have been the one to give you the full epidemiological definition, but what I can tell you is that the case definition changes over time. And what we have in Trinidad is a case definition that is monitored by the epidemiological department, and it's based on the countries that have endemic spread, meaning that it will spread within a community in those countries. So like, let's say you've traveled, not you specifically, but a person has traveled from Italy, from Iran, from China, and they've come to us within the last 14 days, start developing symptoms, then those are the people who require testing. The way that epidemiology works is that those people are considered highest risk, and they would initially be considered a suspected case based on their travel history once they exhibit these symptoms. So you kind of have to subdivide that into different things, meaning that if you come from one of those areas and you're well, so let's say you come from China but you're well, that doesn't mean that you've come here with COVID-19. But what they will do is quarantine you. Well, okay, so that's not fair. So they will not let you into the country. That's the first thing. But let's say you are Trinidadian and you've gone to one of those places within the last 14 days. They will quarantine you for 14 days to ensure that you do not develop those symptoms or develop any symptoms at all. And if you have not developed any symptoms after the quarantine period, then you probably were not infected in the first place. And that's good. If you have developed symptoms, you will be tested via a nasopharyngeal swab, which is available within the healthcare system, and those are tested through the public health laboratory. And just on that note, these are very specific things, and I'm sure you would have seen the release from CAFA coming
Yes.
out, and that's really important because it is not just a test for coronavirus, but this is a specific type of coronavirus. This is COVID-19. And this is also an epidemiological test. So not test, but an epidemiological issue. So all testing has to go through CAFA. So it cannot be done in any other lab, and CAFA is the only lab that's doing acceptable testing at this point in time.
So we have the testing that's being done. You're put in quarantine for 14 days.
Right.
What happens to the patient while in quarantine?
Right. So the primary care system within the country will follow up all patients who are in quarantine, meaning that they will check in on them daily. So there's a network of community medical officers of health, county medical officers of health. And those people will have their staff check up on these people every day to ensure that they are well, that they're not developing fever or any respiratory symptoms. If they're fine, they just continue that observation. If they develop symptoms, then they get transferred into isolation into one of the areas that are designated for this. And there are designated areas in the public institutions.
Okay, so let's just say that you're being monitored at home.
Mm-hmm.
What about the other people in the home?
Well, quarantine means that you're not interacting with them. So quarantine means that you're by yourself. You're getting, it's supposed to be like that. So you're not interacting with your other members of family in the house and so. So you're alone.
So you're on lockdown?
You're alone.
Oh,
Yeah.
for 14 days?
For 14 days, yeah.
Why specifically 14 days again?
Well, so this is where it's a little bit confusing for this one, because there are reports coming out where the incubation period is variable. And incubation really means that you may be a carrier, but you haven't started to exhibit symptoms of the disease. And that means that you may appear well, but you actually are coughing and sneezing, and some of the viral particles are coming out. And those are the people who have the potential to spread without really being identified and isolated. So that's why they take the precaution with these specifically.
All right. What about those who are already struggling with a compromised immune system?
Yeah. So that actually where the problem lies. And again, if you look at the data coming out of China and so, because they're now recovering, or at least attempting to recover their health systems. I mean, and the data is coming out slowly, but even in places like Singapore, Japan, the data is reflecting a higher mortality in specific groups. And when I say specific groups, I mean the elderly and the immunocompromised. So people with HIV, people chronic steroids are considered immunocompromised, and certain diseases that are actually quite common here. So patients who have lupus, sickle cell disease, etc. Diabetics, we have a lot of diabetics, they're considered immunocompromised as well. So we have a very large part of the population that we are concerned about, and that's why the best way to tackle this is actually head on, and try to prevent the spread as much as possible. I just want to make the point that we're speaking about this now, but this is actually something that should be spoken about all the time when it comes to influenza, because we actually see a lot of influenza, and I'm sure you would have heard ministers speak about the number of vaccines, the number of deaths, and you know, the advantage of I use that word very loosely, but I don't think I've ever said the advantage of influenza in my life before, but the better part of influenza is that there is a vaccine, as opposed to COVID-19 where there's no vaccine at this point in time. And to know that people shun the vaccine is really hard, because they're putting themselves at risk, and in doing that, you're not just harming yourself, but you're also harming people who may be immunocompromised and can't access the vaccine, or are youngest in society who don't get the vaccine. So you have to think about those things on a larger scale. So it goes beyond just yourself. So a shame on the anti-vax community, because they're very wrong in what they say and what they preach. And I would strongly endorse all attempts to vaccinate the population at all times.
Okay. Now, just at the start of the conversation, you mentioned about, you know, people, you think it's just a virus, you think it's influenza, and you go about your way. What do you do if you develop the symptoms of COVID-19?
Yeah, so the idea is, it's interesting. I was just chatting with Dr. Parashram before we came on. And he's doing such a fantastic job. The ministry is under duress at this point in time, as they should be. Roshan is leading from the front, with Minister, of course. And they have actually started the process to set up a hotline that's available to the public, where people could call, discuss their symptoms. So we're working on the logistics of that through the Medical Association with him, and hopefully that will be something that will unfold soon. As of right now, the institutions will all have areas where people can present and be screened. Now, each area will have a separate, what we call triage. And triage is just that process of sorting, but of course we can't mix people with respiratory illnesses, especially with the general population. So you should not feel bad or feel upset if they ask you to go into a separate triage area. It's just a precaution in every single hospital around the world right now. And in that triage area, they will ask you the questions that are pertinent. So they will ask you about your travel history to start off with, because that determines a lot of what we do. And then, of course, the symptoms related to both upper and lower respiratory tract infections. Because if you do have a lower respiratory tract infection, which is a pneumonia, then we need to take different care of you.
Speaking of travel, let's just say you have to travel.
Yeah.
What do you do?
That's a very interesting question that came up in even my family recently. Non-essential travel is not advised. So if it's absolutely essential, then yes. Recreational travel is probably not the best idea now until I guess the world gets a better grip on what's going on. But certainly travel to certain countries should be off limits. So if you tell me you booked a flight to visit Rome, that probably is not the best idea.
Good idea.
And they probably wouldn't let you in anyway.
Oh, okay, but what do you do? Is there anything extra that you need to put in place should you need to travel, regardless whether it's a country with the COVID updates?
So it's a challenge in airports because of the number of people, and you'll see them speak about public gatherings a lot. But if you think about it, going through an airport is somewhat of a public gathering, not for a specific reason, but you're encountering so many different people who may or may not be ill. Who may or may not have sneezed on the counter just before you went to check in your bags or whatever. So it's important that you take care of your own health. So you sanitize your hands. You try not to touch any areas that are not absolutely essential. You'll see the immigration officers and so taking their own precautions. They'll wear their gloves. They'll wear their masks. The use of masks is controversial at best. You do see people walking around just with all sorts of stuff. I mean, it's kind of crazy.
I have to ask about the mask, because even today in the paper there's a virologist who mentioned, listen, the N95 masks isn't...
Yeah, so I don't know if you knew this, but wearing personal protective equipment is actually something that's taught. So people actually have to be trained on how to use the gown, how to use the mask, how to use the gloves. And it's a process of putting it on and taking it off. And all healthcare workers have to go through this training before we deal with
So you just don't get a mask and put it on?
No.
Okay.
Because even the N95 has to be fitted to your face, and it has to be worn in a specific way for it to be considered effective. And interestingly, Avery actually taught me this. If you have a normal face mask, so I'm talking about just a surgical face mask, and this is the one you see people walking around with all the time, and they figure that they're protected and nothing will go wrong. One is that it may not give you full protection because it's actually open on the sides. Two, it gives you a false sense of protection, so that when you're wearing it, people just figure they're not going to get anything, but they're touching their eyes and they're touching their mouth, and they're increasing their risk, and they're actually increasing their risk. And the third one is the moisture of the human breath on the mask actually increases the uptake of certain viruses, so it can actually increase your likelihood of contracting it. So yes, I know there's been mass pandemonium, like we said before, and people panic buying everything off the shelf in all the different pharmacies. But you have to know how to wear it, what to do, when to wear it. So in healthcare, of course, it's important that we don't end off, because we actually have the highest risk. And again, if you look at the data coming out of a lot of the countries, healthcare workers are the ones who contract easily and the ones who die easily. So there's of course a big push to make sure that the healthcare workers are not decimated at the end of this globally.
All right. So as we get ready to wrap up this conversation, some COVID-19 survival tips.
Yeah. So I've provided the station with basic hand washing material, and that's from the Ministry of Health. And I think for me, if that's the point I could get across today, the most important point, that would be it. I would say categorically that people should wait on releases from the Ministry of Health. There's no boogeyman who is trying to fool the population. The material that's coming out is valid, and we're guided by not just the Ministry of Health, but by the World Health Organization. So don't buy into the panic. Do the correct things. Do the basic things. We will all pray that it does not come, but the reality is that as a virus, just like influenza, and influenza came and has caused a problem, maybe what will benefit our system is that people have a higher degree of personal hygiene, and that might actually help our population moving forward.
One final question for you.
Sure.
What's pandemic versus epidemic?
Yeah, so it's an epidemiological term. So I again will give you across the Avery to give you the full definition of that, but it speaks about the global spread versus the internal spread within the country.
All right. Thank you so much.
Thank you very kindly for having us.
Dr. Darren Dookeeram, consultant at Accident and Emergency Sangre Grande Hospital, also president of the Trinidad and Tobago Medical Association. We hope that the information shared this morning served you well in protecting yourself and safeguarding your loved ones and looking after each other here in Trinidad and Tobago. Our time, it is now 10:32.